Hi, I'm Andy Ginther. Over 7 years ago, we started our journey to ensure that babies in Columbus and Franklin County made it to their first birthdays and beyond, regardless of race, income, or neighborhood. Today, you'll hear more about the work of CelebrateOne during this past year and what your efforts and support have meant to our community. We know that more babies are thriving in Columbus and Franklin County because of your support. This year alone, we've assisted nearly 4,000 moms through our Connector Corps and Navigators, distributed over 1,000 cribs to those without the means to provide a safe sleep environment for their newborn, and trained hundreds to become safe sleep ambassadors. These are just some of the ways your involvement and donations are making an impact. As I shared over the summer, we've reduced infant mortality in Franklin County by 28%. and lower the infant mortality rate in CelebrateOne priority neighborhoods by 20%. Sleep-related deaths decreased throughout 2020 as well. At the same time, the pandemic further illuminated the pressing need to address those disparities that continue to persist. Black babies die at a much greater rate, and in 2021, our data shows that while we've experienced more infant deaths this year, your support will be instrumental in helping us serve moms and families in our community. Our dedicated staff at CelebrateOne and Columbus Public Health work every day to connect pregnant moms, families, and infants to resources so they can lead healthy, fulfilling lives. Let's hear more from CelebrateOne Executive Director Maureen Stapleton on how we're making an impact.
Hi, my name is Maureen Stapleton, and I am proud to serve as the CelebrateOne Executive Director. The COVID-19 pandemic has greatly magnified the health disparities in our community. While we have made progress in infant mortality as a city and a county, we know that the pandemic has affected the progress of our entire community. Black babies are still 3 times more likely than white babies to die before their first birthday. While COVID has taken its toll on infant mortality, we know that not having adequate housing, food, employment, and access to advanced skills and education to get decent jobs is affecting moms and families throughout Franklin County. We call these the social determinants of health, and CelebrateOne works with our partners regularly on these issues. Columbus Public Health's long-standing partnership with CelebrateOne supports housing, home visiting, breastfeeding support, and they provide cribs, car seats, and safe sleep education to address preventable deaths and the social determinants of health. Because of the generous donations and support in the past years, we developed Healthy Beginnings at Home, a pilot program that provided housing for pregnant women to improve birth outcomes. Healthy Beginnings at Home emerged as policymakers across the state of Ohio were grappling with the alarming rates of infant mortality for Black families. There was a growing consensus about the role that social determinants of health played. State policymakers in the legislature and administration began questioning the role that the lack of affordable housing was playing. The preliminary findings of Healthy Beginnings at Home have policy implications for local, state, and federal elected officials, policymakers in the healthcare systems, managed care organizations, maternal child services, and housing providers. We are leading the way with a statewide partnership to help with this effort.
CareSource is one of the managed care organizations that serves the state of Ohio. We are one of the health insurance providers for individuals who are on government-sponsored healthcare. Healthy Beginnings at Home started as a micro-pilot in Columbus with community development for all people, led by Reverend John Edgar. And as they worked with moms in the community, they started seeing a trend that many of the moms that were having unsuccessful pregnancies or who were having negative birth outcomes, that they often were unstably housed and they were fighting to keep their housing. And that seemed to play a very large role in the women's physical and mental health space. And so there was a 10-woman pilot, and in that 10-woman pilot, housing was provided, many social supports. And what we saw at the end of 18 months was that the women had successful pregnancies. All of them were able to give birth to healthy babies. And at their first birthday, the babies were still thriving. But it was just 10 women. As we started sharing this information and as Reverend Edgar looked for other stakeholders within the community, CelebrateOne stepped up and really saw an opportunity to take this to a larger scale. There were so many partners that they brought together from across the city. Out of that, we responded to an application for funding at the state of Ohio and were awarded just under $1 million to take Healthy Beginnings at Home from that little teeny 10-woman micropilot to the 100 women who participated in the research study and have brought us to the outcomes and the success that we see today.
We could not have done this without the partners you see on the screen. This is yet another example of the Columbus way. Additionally, in recent years, there has been an awakening to the understanding that racism and disparate treatment in healthcare impacts birth outcomes. The leadership of the City of Columbus and Franklin County have declared racism as a public health crisis. The debilitating long-term effects of implicit bias and discrimination is the reason the health of Black and brown mothers and families is one of our top priorities. All of our hospital systems are locking arms with us on this critical issue and working to educate the next generation of service providers and making systemic changes to ensure that all families receive the level of care they deserve. Throughout 2021, our dedicated team of connectors and neighborhood integration managers have stepped up to ensure there were no gaps in providing much-needed resources to our families. We continue to provide cribs, safe sleep training, education, and even moral support for moms and dads during their pregnancy journey.
Columbus has a very high infant mortality rate. Without CelebrateOne, we would not be able to curb that statistic. We focus on targeted neighborhoods. We go door to door, we knock on these doors, and we try to connect with those parents in a face-to-face situation. And with our services, we're able to not only service baby, we're able to service mom and dad. We're able to connect them to housing, the code enforcement, refuse, to keep our neighborhoods clean, because if the neighborhoods are clean, then the kids have a safe place to play and a safe route to walk to school. So it all plays into one big pot. Getting into this, I did not want young fathers like myself to be at a disadvantage. I wanted them to have the knowledge to be able to make bottles, change diapers. I was blessed with the opportunity of having a father who was involved in my life, who taught me, hey, make sure you're there from day one and be a dad. When we see CelebrateOne, a lot of people think mom. But statistically, when father is in baby and mom's life, mom has a higher chance of a successful pregnancy, and baby has a better chance of seeing the age of 1.
I was out on the west side doing some work, going into our non-traditional areas, our corner stores, our gas stations. And I was hanging out flyers, yard signs, and I got a call one day from a dad. And he said, your flyer says that you help moms. However, I'm a dad. He said, my son was born in February. I have full custody. I live with my mom. She's helping me, but she works as well. And he said, I need help. Do you help dads? And I was like, wow, I'm new. I'm like, well, do we? So I immediately jumped into looking for some resources for him. I linked him to the Father Factor program. They called him immediately. He called me back a day later. He said, I don't know who you are. He said, but I am so grateful for you. He said, the program called me back and they're helping me. And that kind of stuck with me and gave me another outlook as to say, we need to help our dads too. Our dads are a major factor in families, whether they are in the home or not. They need to be that role in that child's life, and we need to make that healthy to be able to parent as well.
parents need a list of everything from formula to diapers, car seats, sleep safe trainings, you name it. Anything that involves a baby, we have connections to it.
Our connectors and neighborhood integration managers are the backbone of our organization, and their work is how we remain connected with literal boots on the ground in our community with canvassing, diaper drives, car seat checks, and the list goes on and on. Since August, connectors have met more than 300 moms and families each month through traditional outreach, referrals, canvassing, and social media campaigns. I extend my sincere thanks to all of the connectors and neighborhood integration managers working to reduce infant mortality in Columbus every day. Back in May, we hosted a community drive-in at Easton Town Center in an attempt to attract new families into the CelebrateOne network. We served 85 families that night with family-friendly movies, snacks, and a special gift for moms thanks to Zeta Phi Beta Sorority Incorporated, as well as food grocery boxes thanks to our partnership with Farmers to Families. All of those families were connected with community health workers too. The whole summer was full of special events. Through these showers, we served nearly 500 pregnant women and parenting moms and dads, making sure that they had supplies for their newborns, as well as a chance to connect with community providers who signed families up on the spot for connections to invaluable services and support. We ended our event season with a community's first birthday on the park at Dorian Green, Kosai's front lawn. Smash cake photos, costume characters, arts and crafts, and so much more. New this event season, safe sleep trainings conducted at events, which really broadened our outreach and helped us reach our goal of training over 700 safe sleep ambassadors this year. And I'm really proud of our team for supporting these families and connecting them with needed resources. And as I said that day, we live and work to celebrate one. As we move out of 2021, I'm looking forward to how we will continue to work to move the needle in infant mortality and to find creative, new, innovative ways to address the impact of a 100-year pandemic. We are trying new things, like our maternity podcast, sharing resources and information on how to combat infant mortality. We will continue to engage our moms and dads on our social media pages and through our website. We will continue to innovate and increase our outreach through community events. Our 5-year strategic plan, what I call CelebrateOne 2.0, will position us to fundamentally impact the health of moms and babies. Keeping our foot on the gas is imperative if we are going to keep the trajectory of our progress moving in the right direction. We need your continued support to keep this momentum going. We thank you.